Well, in our latest study, we looked on the influence of Lactobacillus reuteri on gingivitis and plaque control in pregnant women. And therefore, we selected a sample of pregnant women at the end of their second trimester who were willing to participate in the study. And the study design was a double-blind, placebo-controlled trial. So we didn't know whether we were giving the active lactobacilla to the women or whether they just received the placebo treatment. And the placebo consisted of lozenges which contained Lactobacillus reuteri in a fairly high concentration, and the women were asked to consume them twice a day during the rest of their pregnancy until the birth of their child, and within 3 days after birth we came in and re-examined them. And the parameters we were looking on were the typical parameters for gingival inflammation. It is once the gingival index, it's a fairly old index, and which shows how much inflammation is on the gums. And the second parameter was plaque index, because we know that there's a strong correlation between plaque and gingival inflammation. That means normally the more plaque you have, the more inflammation you have. And we also just recorded an index to see how much plaque there was on the teeth, and we just looked on 6 specific teeth, the so-called Ramphia teeth, which are representative for the mouth, and we didn't give them any recommendations or training for oral hygiene. It was just really giving them the lozenges to consume. And at the end of the study, we made some really interesting, or found some really interesting results, because we saw that during the 3 months period in the test group, the gingival index really was cut into 1/3, which is really dramatic. So basically in the test group, gingival inflammation was completely gone, or almost completely gone. Only mild gingivitis was in some women still present, while in the control group there also was sort of a reduction, as you would expect, because during the third trimester of pregnancy, the values go down a little bit, but it was not really significant from a statistical point of view. And when looking on the plaque control, that was even more astonishing, that although both groups had at baseline the same amount of plaque, they were not really proper oral hygiene. They had a rather sloppy oral hygiene, but we didn't give them any instructions. And at the end of the study, again in the test group, who was using the reuteri lozenges, the plaque index, the mean plaque index, was cut also again into 1/3. There was a dramatic improvement in plaque control. Meanwhile, in the control group, nothing changed that would be significant. So our data suggests that besides proper oral hygiene, which is still the recommendation number 1, of course, in pregnant women, or not only in pregnant women, each of us should brush twice a day the teeth with a toothbrush and toothpaste, and thus avoid gingival inflammation. But in those who are more at risk, and women during pregnancy are more at risk for gingival inflammation, those who have the higher risk, that's what we think will benefit from the consumption of those probiotic lactobacilli.